Go ahead.
This is a demonstration of a vaginal cytology, but I'm not going to use the vaginal speculum today. So I'm going to start out by restraining this dog. Brittany's restraining for me, and I've got the tail, and I'm going to wipe with chlorhexidine solution and saline. And I'm going to just kind of gently cleanse the vulva. I'm not using alcohol because it has very much a drying agent, and I don't want to dry out this area because it's quite tender. I've got some very much soaked. I'm going to alternate chlorhexidine, saline, chlorhexidine, saline. Can somebody hold the tail for me, please? Okay. I'm going to get my swabs ready. They're sterile. I'm opening them up. I'm going to moisten them to help pick up the cells with saline. Right. I'm going to put on sterile gloves. Grab my cotton tip applicator. And at this point, if I was using a vaginal speculum, I would insert it with the tips lubed. I find it easier to do it without. So I'm going to insert it at about a 45-degree angle and then straighten. And I'm just going to rotate it against the vaginal wall. Okay. And she's in heat, so we would expect to see some red blood cells, and I'm going to roll it onto my slide. I'll do one more. Pulling the vulva down. See, it's quite swollen from being in heat. She's tolerating this quite well. Get them all out. And then I would stain these to look at the cells to try to determine what stage of estrus they're in. I would also look for bacteria if we were worried about a bacterial infection. We could also use this to look for things such as neoplasia or tumors, because those types of cells would also show up. And that's a vaginal cytology.